Welcome to the Pharmacist Voice Podcast, episode 268. I'm your host, Kim Newlove. I am a pharmacist by training with experience in hospital, retail, compounding, and behavioral health. As of 2017, I'm not in clinical practice anymore. I am a voice actor and a podcast host. You can find my business and my podcast on my website, thepharmacistvoice.com. You can also find the show notes for this episode on thepharmacistvoice.com. Just click on the podcast tab and then find episode 268. All right, in honor of Poison Prevention Week, which is March 17th through 23rd of 2024, this podcast episode aims to engage college students ages 18 to 24 and the people who care for them, like pharmacists, pharmacy students, pharmacy technicians, and of course, parents. Before we get started, listener discretion is advised. Some of the topics that we cover in this episode may include illicit drugs, poisonings, injuries, and death. These are sensitive topics, so if you have small children in the car or impressionable individuals listening with you today, listener discretion is advised. Thank you. Now for some background about how I picked this age group, the 18 to 24-year-old young adult age group for this year's poison prevention episode. My inspiration for connecting poison prevention awareness and the 18 to 24-year-old age group is a book that I read. I read this book when my younger son, Derek, started college in 2023, August of 2023. The title of the book is The Naked Roommate and 107 Other Issues You Might Run Into in College by Harlan Cohen. I was curious about what college was like these days and what best-selling books about the topic might have to say. I listened to the entire audiobook, and I know that my son made it about halfway through. Hopefully, he made it the rest of the way through. It is a great book, and I highly recommend it to both parents and students. The book cautions parents not to read that one, but to instead read a different book by Harlan Cohen. But I must say, telling me not to do something is like saying do it even faster. I read this one, definitely. All right, some reviews. What do the reviews on Amazon.com say? The Naked Roommate book is labeled as a New York Times bestseller and an essential college life survival guide and graduation gift for students. One review of the book is titled, What to Expect in College Away from Home. The title of that review summed the book up perfectly. Parents and students are reading this New York Times best-selling book and thinking of it as what to expect when you're expecting, but for the college experience, right? As I read the book, of course, I enjoyed it. It was eye-opening. I was curious, and my curiosity got satisfied. I would definitely recommend it to other parents who are sending their children off to college. However, a chapter in the Naked Roommate book inspired me to engage the 18 to 24-year-olds and those who care for them on the topic of poison prevention in today's episode. The chapter that inspired me is titled Drugs on Campus: The Smoking, Snorting, and Pill-Popping Truth. Actually, the chapter and the resources at the end of the chapter inspired this podcast episode. Among the resources, the Poison Helpline is not mentioned, not that I could see. Now, if you're unfamiliar with the Poison Helpline, the number is 1-800-222-1222. Program it into your phone today. It's an important one. And in my humble opinion, the Poison Helpline number would make a great addition to the resources in the Naked Roommate book if it is ever redone into a third edition. I think I read the second edition. Put it in the audiobook too, Harlan Cohen. It would make a great addition. Now, if you're wondering why the Poison Helpline would make a great resource for a book whose audience is college students and maybe their parents too, you are going to enjoy this episode. Poison educators Dr. Wendy Stefan from the Florida Poison Information Center in Miami, Florida, and Angel Bivens, RPH from the Maryland Poison Center are with me today. We're going to discuss how the Poison Helpline is there for you, especially as a college student, a parent, or a pharmacy professional, so that you can add the Poison Helpline to your own personal list of drug-related college resources. Although we're not going to talk about all the drugs that a college student ages 18 to 24 might encounter on a college campus, like the naked roommate does, what we are going to talk about is the following 6 topics. Number 1, what a poison is and how some drugs on college campuses can fit the definition of a poison. Number 2, when to call the poison helpline versus 911 and when to go straight to the ER. Number 3, what to expect when you call the poison helpline with a question. Number 4, some real life cases when young adults ages 18 to 24 called the poison helpline with a question. Number 5, why people self-medicate with drugs, tobacco, and or alcohol. And finally, campus resources for mental health and substance abuse prevention and treatment. There will, of course, be some sidebar conversations that are some are funny, some are serious, but without further ado, here's my conversation with Angel Bivens, RPH, and Dr. Wendy Stefan. Hi, Angel and Wendy. Welcome back to the Pharmacist Voice podcast.
Hi,
It's
Kim.
great to
Thanks
be
for
here.
having us.
My pleasure to have you both. Now, we are doing this as both a video and an audio episode. If you are listening to this in audio and you want to switch over to the video, go to youtube.com/@ the pharmacist voice. You'll find us there. And I would like to have Angel introduce herself first, then we'll move on to Wendy. Angel.
Hi, my name is Angel Bivens. I'm currently the Director of Operations and Public Education for the Maryland Poison Center.
Right. And I'm Wendy Stefan, educator and epidemiologist at the Poison Control Center in Miami.
Great. Thank you so much for being with me today. Let's dive right in. I'm going to have each of you speak throughout this podcast episode, but first I'd like to start with Angel, and let's just do some general definitions here. Angel, what is a poison, and how can some of the drugs that are found on college campuses be considered poisons?
Yeah, it's always great to define, the topic that you're going to discuss. So, to set the stage, a poison is defined as anything that is used in the wrong amount, or by the wrong person, or in the wrong way. Okay, so some examples, especially in this age group, the wrong amount. If you take an accidental double dose of a medication, or if you take something in excess, because if one is good, 5 are better, that would be the wrong amount. We would consider self-harm being the wrong amount, because you're clearly taking intentionally too many pills of whatever medicine to cause harm. The wrong way. How do we get into trouble with the wrong way? Well, if you are trying to use your contact re-wetting drops, and you reach out and put in, it was the artificial nail glue. Your eye's going to be sealed shut, and what do? Okay, so that is essentially a poison, right? Using things in the wrong way. We have folks who use regular household products in order to get high. Okay, whipped cream cans, for example. All right, so that would be using something in the wrong way. And then the wrong person, that's very simple. Sharing medicines with friends. Just because it was prescribed for a friend for what you think are the same symptoms you have, it could cause you harm if you go ahead and take that same medication. So, wrong way, wrong amount, wrong person. Any kind of substance you use, whether it's drug, household product, plants and things like that, can become a problem.
Thank you for sharing that. Wendy, anything to add?
Just having had, two daughters who are in this age group. It's been interesting to observe them and sort of the types of situations they encounter, as young adults. And it's been a lot of, trying to do things on your own for the first time. So cleaning, taking medicine. I was glad you mentioned that, Angel, because that seems to be a big thing, trying to manage your own symptoms away from home, in some cases. And then, of course, all of the sort of substance use issues that come up for friends, and they're trying to navigate or help friends or make choices for themselves. I would agree.
I appreciate you guys laying the foundation. That's good information. Now, the next thing we're going to talk about is kind of a differentiation piece. There's a time to call the poison helpline, there's a time to call 911, and there's a time to go straight to the ER. Let's talk about when you do each one. Angel, let's start with you.
Yeah, I think the framework that we use is if somebody is unconscious, having trouble breathing, having seizures, you can't wake them up, or you're concerned that they're going to head in that direction. Those are all instances where it is really important that you call 911. Okay. Um, so that they can get help right away. In the absence of those things, I think you do have time to call the poison center, because poison centers can quickly triage and determine what is happening, and can determine, number one, is a healthcare facility even needed at all, or can they help manage it right where you are? Number two, if a healthcare facility is needed, is it something that needs an ambulance, or can you safely transport on your own because symptoms are going to be delayed, or it's not a life-threatening situation? And then finally, poison centers would be able to say, oh no, this is something that the person can deteriorate rapidly. We want you to call 911 and get them there as quickly as possible.
Great info. Wendy, would you like to maybe expand on that?
Well, sure. You were saying sort of when you make what call, and I think that's an important point to bring up, that we want to empower young adults to know sort of what resources to use at what junctures. And so ideally, I would love for our young adults to be reaching out to the Poison Center with questions before they do the thing, as my daughter was saying. I did the thing, now what? Right? So we want them to actually take a step back and know that, hey, before you combine that over-the-counter medicine and your whatever prescription medicines you're taking, before you add alcohol to that muscle relaxant you've taken for the sports injury, we're even there for that. So the Poison Centers, that's kind of a step back. Accessing healthcare on campus in a new environment can be really challenging. And so that takes some time to establish, where is the clinic? What services do they offer? So I really like the idea of equipping your young adult with the Poison Center number so that they can really avoid things early on, because my daughter has used it when she was in college. She used it for friends, and I think just that's also just something to consider, because that's a resource available to them for free that is confidential. The other thing too is that I was really struck by, the decision about driving to the ER versus, calling rescue. Um, in general, the recommendations I've heard from our partners are basically you don't ever want to drive yourself to the ER, really. If something is acutely going on and you're seeing dangerous symptoms, it was very interesting to hear just all the capabilities they have on the vehicle. We shouldn't think of it just as transport. And I think sometimes you think, well, I can get them to the ED faster in my car, right? But you're not treating them on the route, right? The treatment can actually begin on scene. So for instance, naloxone, right? If you don't have naloxone yourself, which we do actually recommend that young adults do carry naloxone, they have it on the vehicle. So, driving all the way to the hospital, parking, getting the person in, filling out whatever forms, whatever, you can actually start care a lot faster with rescue.
You two work so well together when we have these podcast episodes. I just want to say thank you. This is great information.
Well,
Absolutely.
we're great to have each other as colleagues. It's really nice.
Yes.
It's a
That
nice
is
team.
absolutely true. Yeah, and
Now,
I want to echo what Wendy's point, the important point. A lot of people do think that um, you actually have to wait for that situation to happen to call the poison center, and we are very happy. And one of our missions is to try to prevent bad things from happening, right? And so one of the ways to do that is to make that call whenever it's informational. And we do get calls. Hi, I was prescribed this antibiotic and there's a party tonight on campus. Is it okay if I drink? Thank you for calling ahead of time, because yes, you want to go ahead and avoid having those couple of beers while you're taking this medicine. So yes, we would love to prevent things from happening if folks would call us before they do what they want to do.
And even things that are less acute. I think too, it was great. One of the calls that I reviewed, not this time, but a previous project, was a young adult calling because she was very scared because she had eaten an expired pancake. And I kind of chuckle, people kind of laugh when they hear that, but it was a great opportunity for us to talk to her about what, these best by dates mean and don't mean. So that was some food safety education for that young adult, and we don't get a lot of food safety education unless we're working in food service, right? So that was a nice opportunity for us to sort of take away some of the fear and misunderstanding about taking care of yourself and feeding yourself, for instance.
And it's great that you just brought up that point. One of the most important things that poison centers can do is decrease anxiety, right?
Yeah.
Don't sit there and worry yourself up into panic or worry. Give us a call. We'll let you know if you have to worry. But clearly, eating an expired pancake, definitely, we can take that down a notch and take the worry away, and you can worry about something more important, like your final exams or something like that.
Angel and Wendy, for any college kids out there, we know a lot of them are poor college kids. What is the rule on expired food?
Well, generally speaking, a best by date is exactly that. It's going to taste best by that date. So, the chips might be less crunchy, the pancake might be a little stale. But if you're trying to save money and you don't want to throw something out you spent money on, which I know is the case, my daughter said, "Oh, I can't believe, I thought I didn't realize this was so old," or, you don't want to waste money. So we can reassure folks that they're not going to actually get sick. It's not really a spoilage date. And there's talk about kind of trying to adjust some of those dates to avoid food waste now. And I think that's a great idea because people really don't understand what it means.
Yeah, I would agree. The dates. If your milk is right there at the sell by date, definitely take a good sniff. Definitely go ahead, pour it in a glass. If you see curdles, then you're on the road to cottage cheese there, and you probably don't want to pour that on your cereal, but
Well,
probably not going to hurt you.
and young adults, honestly, are generally not very, vulnerable to food-borne illness compared to other populations. So, they're really unlikely to get sick, even if there is something that's off. I would worry more about our older adults, our small children, or say people with diabetes. Those are the folks who, if they're exposed, they're likely to have some serious harms.
Right, I would agree.
When we started on this topic, before the pancake came into the equation here, we were talking about when to call the poison helpline versus 911 and going to the ER. I think you guys did a great job of answering my question, and thank you. Now, at this time, I wanted to bring up something. I don't know if this is fair for me to do because my listeners and my viewers can't see what we have seen, but there was a skit on Saturday Night Live about calling 911. I'll just recap it real quick. There were a bunch of college professors who got high on marijuana during some sort of a holiday party, I believe, and they called 911 and they were asking for the hospital to be brought to them. And I just
Because
thought,
they were dead, I think,
Yes,
right?
yes,
they
I
were in
think
fact dead.
there's a lesson even for the college professors, not just the students to learn here. What is the lesson, Wendy?
Yeah, so that was a great skit, and somehow I had missed it. It was pre-pandemic, so I feel like I might have missed it. There was a lot going on. But yeah, so I think the lesson really is the potency of our cannabis derived products these days are not your grandparents, not your 1970s cannabis. Let's put it that way. So yeah, so I think this goes also for young adults, right? Not only older adults, but people who are new to cannabis use, trying it for the first time. Some of these products out there are incredibly potent, with really high, THC or tetrahydrocannabinol, concentrations where they're having full symptoms, including things like hallucinations and they're not necessarily expecting that, right? So if you're expecting sort of a mellow, relaxed, chill experience and you're new to cannabis, that may not be what you get.
And along those lines, also, our catchphrase is start low and go slow.
Yep.
Okay, so it's one thing when you're talking about the cannabis that you're going to purchase and maybe smoke. If you are trying to, if your first use is with an edible, keep in mind that you really need to pay attention to the packaging, because packages might not be a single dose, right? Typically, you would start off 5 or 10 milligrams of THC content if you're looking at an edible product. But some of these things, these candy bars and the candies, the things that kind of look like Nerds ropes, or the things that are like Cheetos or Doritos, if you look closely at that package, there are 500 or 600 milligrams of THC in one of those packages. And I don't know about you guys, but I personally don't eat a single Cheeto or a single Dorito whenever I open a bag, right?
It's never
I'm going to
happened.
eat the whole, right. I'm going to eat the whole bag. Well, if I eat the whole bag, boom, that's 600 milligrams of
Oh.
THC. I could very much see me saying, I'm calling you because I'm dead and I want you to send all of the hospitals to me.
When we're laughing, we're learning. I love
Yep.
this. No judgment, though. Anybody who
Absolutely not.
who
That, I mean,
No,
that's what we're
an
there for,
edible,
is we're there to kind of,
yeah.
and
yes.
actually poison center specialists, that those are the people you want to talk to about that, right? Let's leave those poor 911 operators alone, okay? Because they do have other emergencies to worry about, folks with heart attacks and things like that. So
And
um
that's a lot of what I feel like the poison specialists are doing for young adults, particularly sort of like what's normal, what's not.
yes.
Like, I remember years ago, a young caller was calling and she was freaking out. She had taken what she thought was ecstasy, but she was experiencing paranoia and she was driving around and she'd been driving for hours and she was so scared somebody was following her and she had gotten a bad batch, or I think she thought it was interacting with her acne medicine. We were like, okay, what you're experiencing is probably not ecstasy. It's probably more like methadone. At that time, that's what we were seeing at that, that's what was in the drug market. So we were explaining what you're experiencing is actually normal for that drug. You are having symptoms consistent with exposure to methadone. This would indicate that you're in danger, but it is going to go away. You probably have a few more hours of this. We want you to go home somewhere safe, and we kind of walked her through, be with someone you trust, drink some water, probably get out of your car, so that's sort of what's normal, what's not. What a blessing that is for somebody young and trying to find their way, right?
Absolutely. And talking to poison specialists, you're talking to pharmacists, nurses, other medical professionals.
Yeah,
So you're,
doctors.
and doctors, right?
Yeah.
You are going to talk to somebody who's experienced, but also somebody who is more than willing to talk you through things.
So compassionate.
Very
That's
much
what
so.
that's what it's so funny when you sort of look online about poison control, you also often see people say they're so nice.
Yeah.
So we're pleased to have that reputation.
Exactly.
Happy to
And
hear
Wendy, I
that.
think you bring up a really good point there. Whenever you're buying things not from in the case of cannabis, a dispensary. Whenever you're buying things from friends or other dealers, remember, there's not really good manufacturing procedures like you have in foods and commercial medications. And it really is a buyer beware situation out there. Cannabis might not just be cannabis. If you're just buying a baggie of weed from a friend,
Yeah.
you don't know what else might be in there. Or you think you're buying ecstasy and it ended up being tainted with methadone, or you think you're buying an oxy and it's tainted with fentanyl. There's just really no way of knowing exactly what it is that you're getting.
I've
So
seen
by
some
all means, use caution.
I, Angel, that's a good point. I've seen some conversation, and Kim, you may be more familiar with this than I am, about the idea of pharmacists working in dispensaries, sort of some efforts to get these bud tenders to actually have some pharmaceutical training, because so many of us are taking medications, even our young adults, maybe taking things like an ADHD medication, an anxiety and medication and antidepressant, and then they are also seeking out, once they turn 18 in a lot of states, they may be seeking out, you know, cannabis products. So which play nicely together, which don't. And I feel like everybody's flying a bit blind right now without that advice, particularly if they don't disclose to their healthcare provider, all the different pieces of their medical puzzle, as it were.
That would
Which
be
is
an
something that we
interesting
do.
interview if I could have a pharmacist who works at a dispensary on this podcast. That would be interesting to know if they have any sort of formal training on those drug interactions, because as we all know, there could be a problem there. Sorry to break into your conversation
No,
there, Angel. What were you
that's
going to say?
okay. Yeah, and some of it is we are going to be flying blind though, because there's not a whole lot of research
Exactly.
that has been done on cannabis. Hopefully, we will start seeing more of that now to determine those drug interactions. But it's definitely important. It's important for young people to be aware that when you are taking medicines or using different substances, you have to be honest with all of your healthcare team, right? Just so we make sure that you're not going to be prescribed something it will interact. And that's a good use of either your retail pharmacist or the poison center saying, okay, one doctor prescribed this. I went to the dispensary and I want to use this, or another doctor prescribed that. Can I take these things together? But you should be open with all providers. Everybody should have a complete medical history for you.
Yes, we're just about to get into a whole next question about that sort of thing, full disclosure and whatnot. But I do want to wrap up my comment about the Saturday Night Live skit. When we're laughing, we're learning. I think we all learned that it can be funny when they do a skit on Saturday Night Live about professors getting high and calling 911. But those professors could have called the poison helpline, right? I think earlier, Wendy, you were saying that the poison helpline can take more calls like that so that 911 can field more serious calls like heart attacks and whatnot. And then, Angel, you were talking a little bit just a minute ago about talking about sharing all the details. I believe that's kind of what you were getting into.
Yeah.
So let's jump into my next question, which is, what can one expect when they call the poison helpline and they have a drug related question? Angel.
Um, if it's an informational call, depending on what else is going on at the center, they may be asked to hold on for a second because there might be an active exposure that somebody who is actively sick that they might have to take care of. But we're going to ask a lot of questions because we're not there, and it's really important that we get all of the answers to the questions and be honest. The best way that I can describe poison centers is a completely judgment-free zone. So don't feel that you have to hide something when you call because you're afraid we're going to react. If you want us to be able to provide you the right answer and the right advice, we need to hear everything. So definitely tell us all of the medicines you're on. Tell us, what exactly is going on, and what specifically your question is, and we can go ahead and kind of piece it together, and be patient with us, because we are going to ask a lot of questions. But we're not there. We're not in your head. So we need to get a full picture of what's happening.
Well said. We're not in your head because I think a lot of people make things up or they know things. They've perhaps Googled it right before they call you. And they have this bias all of a sudden that Google's right and hey, Poison Helpline, prove them wrong. So, Wendy, can you talk a little bit about when somebody has a bias already because they went online, or maybe talk a little bit more about the judgment free zone or sharing the details? The floor is yours, ma'am.
Yeah, so I mean, in general, our poison specialists, I would say, are extremely friendly and warm, and usually are going to have that time to interact with the caller and answer questions in a way maybe that, their medical professional might not, or they might, they might be more comfortable talking to somebody anonymous over the phone that they don't know, or they don't want to be embarrassed. So I think that's a real plus for the service. And then I would say, you, some of the issues we see with young adults is going to be that they don't want to share the information because they're anxious, or they actually don't know the answer, and so that can be challenging because it's kind of the garbage in garbage out type thing. Or somebody, we just don't have enough information to give advice. And at that point, usually the poison specialist will try, say, I can't really help you. I don't feel like I have all the information here. We don't want to give out information that could be wrong, or lead to a problem. So sometimes we do get callers who simply want confirmation that everything's fine, that everything's going to be fine, right, Angel? And if they're not willing to give you the whole picture, then often the specialist will say, I actually can't say that necessarily is going to be okay. That you may have problems. These are the things we may see, and sometimes the callers get unhappy with that. Like they just want reassurance. But if they're describing a dangerous situation, we can't do that. I was at a harm reduction conference recently, and I had a person who is not in recovery. This person is an active drug user, and had this question. He said, "Well, I like, Xanax and alcohol. I like that combination. What is a poison specialist going to tell me about that?" And I said, "Well, if you're having a great experience and everything's good, you're probably not calling the poison center." Right. So like, no, we would not recommend combining those two things. Like those are contraindicated. That being said, we're there if something is going wrong, right? So I thought that was an interesting comment, and but that's really not what we're there for. Obviously, if they called and asked, should I put these together, we would have said no. But we're not about judging people or criticizing people. We're there to help.
Absolutely. We're going to answer honestly, but that there won't be any judgment. And you hit on a very good point. We don't hear, oftentimes we'll be asked for, does Maryland have a bath salts problem? Well, we don't know, because we don't know how many people are using it and happily using it,
We don't
and
have a
getting
denominator.
exactly
Yeah.
getting the effect that they want. We only hear about the people that are experiencing something that they weren't expecting, or something that they're uncomfortable with, etc. So, and that's fine. We can help with those situations, but you're absolutely right. If you're going to call us and say, can I drink, alcohol with my Xanax, the poison specialists are going to say, no, you really shouldn't do that. But should you do that and experience an unwanted effect, we're by all means going to help you through it. And it's not going to be an I told you so moment. It's going to be, okay, let's see what we can do to help you through this situation.
And Kim, in preparation for our program today, Angel and I both looked at some cases in our young adults. And one of the ones that I found really kind of goes to this, and it was, in this case, this was a 23-year-old male who was calling, who had drunk a lot the previous day and had awakened with all sorts of symptoms, and he was like, what do I do? Like, I feel terrible. I have a headache. I have body aches. I'm vomiting. And so it was trying to understand, like, first of all, is this normal? We're like, this is, definitely related to that alcohol use. And then we were able to walk him through some self-care recommendations, talking about rehydration, sort of how long the symptoms would last, et cetera. So alcohol is a huge issue for young adults, particularly young adults on college campuses. And so it was very interesting. A lot of these calls that I reviewed had to do with alcohol, including, young people experiencing really frightening effects. And so we were able to tell them, that is related to alcohol and you need to seek care right now. Your life is at risk.
Thank you for bringing up the cases. I know a lot of people that are in my audience listening or possibly on YouTube are pharmacists or pharmacy students, and they respond well to case studies. I don't know who wants to jump in there first, but Wendy, you already started. Would you like to present some cases that you at the Poison Center have encountered or you've heard about that you can tell my audience about and they can learn from?
Sure. So I was just looking in the last 6 months. I think we talked about, sort of recent cases, and these are South Florida cases. That's where we are. But I thought they were pretty representative, really, about things happening around the country. And so the one I was thinking of regarding alcohol was, a young woman, 22 years old, described that called in and said she had been drinking about a half bottle of vodka, like routinely, like in a day. And now she was vomiting blood. Like, yeah, I mean, pretty clear-cut case. And, I think it's interesting that, we talk about the acute effects of alcohol, but she was trying to figure out what about these chronic effects? Like, is this something that is now, even though I'm not drunk at this moment, I'm having this scary symptom? Could these things be related? And the answer was definitely. So I thought that was fascinating. I think kids don't necessarily understand the idea of the chronic effects over time. So that was one I thought was interesting. And then we saw a bunch of self-harm. It was remarkable, and I'd seen that in previous years, but I think it hasn't gotten better. Let's put it that way.
Intentional
Um,
self-harm, correct?
yes.
Mhm.
So really, in one case it was vodka and detergent. In another, it was tequila combined with Tylenol, alpha blockers, all sorts of, whatever that person could find, really, really frightening cases. And so I guess it was interesting to see how often self-harm and alcohol came up in these calls. Another person, 24-year-old male who was described as being in recovery, had a pretty significant relapse, combining Xanax, roxicodone, again, ethanol. He's described as a poor historian. Yes, not surprisingly, right? The guy sounded like really seriously affected. But this was one of several cases where Narcan was successfully used, or naloxone was successfully used to keep that caller alive. This call actually came in from the hospital, so they were seeking assistance with patient care. So, you know, some of these cases were really severe. I think not the sort of, little exploratory, oh, I had trouble with a cleaning product type calls that people might expect.
I think I heard you just say that part of that last call with the gentleman that was the poor historian was supportive care to another healthcare provider in
Yes.
an emergency
Yes.
center, perhaps.
That's
Is that
about
right?
25% of our calls actually are
Yeah.
from providers, or first responders, for instance.
That's interesting to know, and I know you've talked to me about this before, but I think sometimes my listeners don't realize that it's not just an individual initiating a phone call. Sometimes it can be a healthcare provider, and so if you're a pharmacist and you feel like you have a very serious case and they're not unconscious yet and all the reasons to call 911, the Poison Helpline is there for you.
Yeah.
Call
Yeah,
them.
and even from the hospital, we are assisting in patient care when someone is unconscious, or they want to use an antidote, or the antidote isn't having the effect they had hoped it would have, or the picture is changing. All of these things where they'd like some support. we're there for that.
And histories
Appreciate it.
are often not complete. Histories might be inaccurate. An individual might think that they took X, and based on their symptoms, that it's evident that they didn't. And that's the other thing that the Poison Center is really good at, is listening and taking down the symptoms that somebody is experiencing and say, yes, it's related to what you are saying that you took, or no, sorry, that's not consistent, but I think it might be this, and going the other way, and then recommending the labs and the monitoring and things like that, and treating the patient based on the symptoms and not based on the history. Histories at a poison center are merely a starting point.
Yeah.
Okay. They're not always accurate. And that's okay. We have a starting point. So we guide the caller, and this can happen even with home calls. Somebody could say, okay, I took this, and this is what I'm feeling. Okay, that doesn't kind of equate for me. I think maybe you're experiencing something else that might have been added to that. And again, so we can go ahead and help diagnose those things.
I
I was
appreciate your input. Wendy, did you want to say anything or continue with cases? The ball's yours.
Yeah. No, so I wanted to mention we were just up with my medical director training first responders in Palm Beach County, one of our communities. And our medical director pointed out, that for them, a cardiac workup, a neurological workup is just old hat. But he said, most of you probably don't know a toxicological workup. Like, what do we need to know? And he was going through a whole gamut of sort of examination type things that are meaningful for him as a toxicologist that a first responder who didn't really have that training wouldn't know to look for. So he was saying respiratory rate is useful, but he said, are they breathing weird? Is it like a deep breath and then no breaths? And then, or is it like, these things actually make a difference. Like, it was so interesting. Does the patient smell weird? Like, do you smell bitter almonds, right? These are some things that actually, if you haven't been trained to look for them, I think you could easily miss. Are they grimacing? All of these things are clinically meaningful, but not everyone receives that type of training. And a poison specialist can walk through those things. Tell me what, are their eyes jumping all around? Are their pupils dilated? So these are really helpful diagnostic tools that are relevant also on the pharmacy side.
Boy, that's a lot of training that I never got in pharmacy school. That's for sure. Yeah.
Yeah.
It's interesting though to hear about because as a former retail pharmacist, I used to have people come to me all the time that probably had information in their eyes or their gestures or their way they were breathing that I did not catch on to. So thank you for that tip. Let's move on to the next case. I love cases. Do you happen to have any more, Wendy?
Let's see. There was one that I thought was interesting and probably indicative of where we're heading. And this was actually a young adult who was in a workplace. She was in a hotel where she was cleaning, and she encountered a chocolate bar that had been left by a guest. Ate the chocolate bar and started to have some symptoms, and then looked more closely at the label and realized it was a chocolate bar with psilocybin, so mushroom, psychoactive compounds from mushroom. So, these products are now legal in a lot of states. I don't know if a lot, a few. And so, again, with travel and internet commerce, these products are turning up in a lot of places where they may not be expected. And so I thought that was really interesting. It's pretty natural for somebody to nosh on chocolate left undefended. So I would expect to see more of these. And we are a bit worried about, the potency of some of these products. Also, their effects on people maybe with a psychiatric history of psychosis or instability, that it could be very, for some very negative effects and even some lasting effects. So,
Thank you for sharing those cases. Angel, when we had our planning meeting, we were talking about some of the most commonly abused drugs on college campuses. They were cannabis, alcohol, psilocybin. prescription opioids. I think that was the big four there. Is there anything you want to add, maybe from memory or some cases that you may have thought of that might be helpful for college kids to understand that this could happen to me and maybe I need to call the poison center when it happens?
Yeah, I think number one, being aware of your surroundings. You know, if you're hosting a party, and you decide that you're going to go ahead and make some cannabis containing brownies, let's make sure everybody's aware, label them. Okay. So that those that choose to participate can, but those that choose not to understand, and nobody's going to be kind of caught off guard. Okay. And that's just good advice for everybody, not just college students, right? Um, you want to make sure that everybody is totally aware. Um, you know, uh, Being aware of what's happening with your friends, is, if you choose not to use, that's okay, and not everybody does. But be a good friend, and be aware if a friend is acting unusual in some way. Understand that the Poison Center can be there to help. Like I said, you can simply call and say, I don't know what's going on. They're not acting right. And just by simply describing how they're acting, the poison specialist might be able to help figure out what is happening. We could ask questions that you might not have thought about, that would give us more information that would then help get you care. So just, we can't say enough about how we're a judgment-free zone, and really we are there to help. That's all we're interested in doing, is helping, so that bad things or worse things don't happen to people.
I appreciate that. Part of what you're talking about really resonates with me as a parent of a college student. And I think that any parents, pharmacists who are parents who are listening to this, can gain some insights too. I believe that during our planning meeting, we were talking about life skills and how including the poison helpline in, for example, a first aid kit could be very empowering for a young person. We as parents need to empower our young people to know when it's time, first of all, to call, but then also to have the number to call. What would you like to add to that, Angel, first?
Uh, um, yeah,
Empowering kids.
I have young adults as well, and it's all about, you're going to make mistakes, and it's okay. But knowing where to get help, and when to do so, is very important. So empowering them to give the phone number, and not just putting it in the first aid kit, put it in the phone, program it in the phone. Doesn't matter, if you're going to school out of state, same phone number, right? You put in 1-800-222-1222 in the phone as a contact, poison control, and that way we know young people never go anywhere without their phones, right? And so that way they always have it. They don't have to think, oh darn, I wish I would have remembered that phone number that mom put in my first aid kit, right? Just program it in the phone. They will then always have it. Okay. And again, poison centers are 24/7. Um, and that kind of circles back to, if you were having a conversation with a provider, and then all of a sudden a question comes up at an odd time that you can't get a hold of that doctor, call the poison center. We can help with that, right? So just knowing that it's okay to ask for help, and that there is a place that you can call for help, it should be comforting to parents if you have this conversation with your kids.
I appreciate those comments. Wendy, is there anything you'd like to add to that?
Well, it's funny you mentioned that because I remember sending my oldest off to college here at the University of Miami, and one of the things I sent with her was, of course, a first aid kit, which was in a bin under her bed, all tidy and tucked, so available right there for her. And when we moved her out 4 years ago, it was still exactly in the same place. So I think your comment about putting it in the phone is going to be the way to go, like having it already there. Because I felt like I was being so proactive. But I think kids interact with help and seek help now in such different ways. And I mentioned too, when I was talking to college nurses and in college, healthcare settings, they said, "Oh, we call poison control all the time." And I asked them, are you providing it for the students? And they looked at me kind of blankly. So I think as we are providing assistance, and if we're working with young people at all, we want to also be preparing them for the next emergency or the next question when you're not there, because that is really what that age is all about, is expanding their independence. And I also like, when I work with this population, I like to talk about it in the context of helping friends. Um, because I think often, you may not be the one to help yourself, right? If you're down from an opioid, you're not giving yourself the Narcan, right? It's going to have to be somebody else there for you. And so that sort of bystander support network where we're helping each other, I think that's a very appealing message. So as you're working with your college age young person, you can say, listen, if this ever happens to your friends, you could be the person to help. And one of the reassurances we do have to provide, particularly for overdose and opioids, is that people will not get in trouble, because we do see, I think most states now have protections for people seeking assistance for someone who's experiencing an overdose. But we just yesterday, I was told a really horrific story about kids who dumped a pregnant teen who was experiencing an overdose, and she died. They panic, they're frightened, they don't want to get in trouble, but they actually don't know the signs. So by the time they realize something's wrong, the person might be, in really bad shape, at which point they don't want to get in trouble for somebody dying. So those type of preparations, how to respond if you need to help someone else, is also a great approach.
I like
And
the
I think
comment about the friend helping friends. I think it's called a Good Samaritan law, where you don't get any sort of legal repercussions for picking up somebody who's not breathing and taking them to get help, or calling 911 and staying with them. Yeah, that's important to know. Do the right thing.
And I think another important message, probably more for the parents in the listening world out there, is, acknowledge that college is a place where there's going to be a whole new world, and that there's going to be opportunities and choices to be made. And so don't stick your head in the sand. Acknowledge that, that stuff is happening. Don't accuse your children, or say, I don't want you to do this. Just say, you're going to be making choices. I've raised you, and now it's time for you to make choices. I want you to go out there and be prepared to deal with the choices that you make. And I think empowering folks and giving them resources where they can find some help. And again, not having to call mom or dad, call the poison center. We can help with that kind of situation, and we can help to be that good friend. In that situation that Wendy was talking about, my goodness, if they would have just called the poison center, the poison specialist could have reassured them, you're not going to get into trouble. This is what you need to do.
Or
This is
let
how
us
you
call
can help
for
your
you.
person. Yeah.
We can,
Mhm.
in fact, if you need space between yourself and the situation, give us the address. We'll place the call, like just reach out, you know.
I like the topic of having difficult conversations or challenging conversations with young people. As parents, we definitely need to do that and not make it sound punitive, sound like you're giving them a resource or you're helping them or their friends. I like where this conversation's going. Thank you so much. Angel, you were starting to kind of get onto the topic of resources. And the last two topics that I want to talk about in our conversation today are number one, why people self-medicate with drugs, alcohol, tobacco, etc., and also campus resources. If somebody either A, needs help with mental health resources, or B, needs some education on substance abuse prevention, or if they're already involved, treatment resources. Wendy, I'd like to kick this off over to you. Why do people self-medicate with drugs, tobacco, alcohol, illicit drugs, etc.?
Well, it's interesting because when we talk to young adults, or we look at surveys, even down to middle school. You ask kids, who are using drugs, or even about other people who use drugs, their age, why are people starting particularly? So what's kicking it off? What are people seeking? And essentially, I think the adult view is, oh, they want to fit in, they want to have fun, they want to, but when you ask young people, they say they're using it to cope. They're going through bad stuff. They have anxiety, they have depression, there's trauma, there's family problems, all these other issues, and basically they're just trying to make it go away for a short period. And I think one thing we have to be honest about is that for in the short term, it works. Right. And I think, when we do drug prevention education, that's hard because we want to say drugs are bad, it's terrible, don't do drugs. But when kids try this, they are indeed distracted. They do indeed forget about what's going on because they're messed up, right? And that window, that break from whatever they're going through is welcome. And so I think we have to be more honest about, the short-term reasons for people to start. And so the key is addressing those things, providing resources in advance. So we talked about the availability of college campuses having now a lot more resources for mental health. A lot more ways to reach out, a lot more support in terms of the environment where you can talk about mental health, trying to reduce the stigma of seeking help. Also for athletes and some of the folks who typically would be hesitant to say like, this isn't working, or I've developed a substance use problem. So there's also more resources for recovery now on college campuses, so that students are coming forward and saying right up front, I am in recovery. I'm going to need to support that through my college experience. Fabulous, right? I certainly don't remember any of that when I was going through college myself. We had to sink or swim. It was like, don't do drugs. If you do, you're lost. And oh, well, bye-bye, you drop out. But I think a lot more schools are trying to keep students supported, keep them in school, and they see that as a reflection on their success. If they're losing students to substance abuse and mental health crises, it doesn't look good for the school, right?
Wendy, where do you think a student on a college campus would find those resources? Would they physically walk to the student medical center? Is there somebody they'd call? What do they Google? Search phrase?
I think it's all the things, right? So some students might want to go walk physically to the student health center because they don't want other people to know. But I also think resident advisors are going to be trained and provide a lot of support, because some students may need to have a conversation with a peer about, I think I'm developing a problem. Like, is this normal for me to drink this hard? Or maybe they're getting help again for the roommate. And that might start with the resident advisor on campus. There are also a lot of social groups on campus that can be either part of the problem or part of the solution, right? So we know that students, unfortunately, who are active in fraternities and sororities, social fraternities and sororities, tend to be more involved in alcohol, unfortunately. And so colleges have been trying to do more to provide resources proactively to those populations to reduce their risk. So I think it takes different forms at different campuses, but I would start with the RA or the student health center, typically.
I would echo that because RAs, some are more hands-on than others, but in general they all receive the same training. So if a student comes to them, they know where the resources are on campus. When students come on campus for the first time, they are overwhelmed with the amount of information provided. And a student might not think, oh yeah, I'm going to need the counseling center, or I'm going to need the health center, et cetera. So they might kind of put that in the back of their brain, or not pay attention to it at the moment. I also think that most campuses have a decent online presence, right? So again, our kids are so much better at finding information on their own than we ever were. And that's part of the technology, right? So I think that just knowing that it's there, and one resource that we really haven't hit on, but since we did broach the subject of self-harm, is, there's that 3-digit number now, 988. And they are there to help 24/7 when folks are in crisis and are feeling like they want to hurt themselves.
I think the key is talking to someone.
Mhm.
It doesn't have to be an expert. And I think, the idea is that's what the stigma reduction is about, is maybe you tell your roommate. Maybe you tell a parent, maybe it doesn't matter, but once you've told someone, I think I'm developing a problem, or my drinking is a problem, or I took this drug and I'm scared, that's a huge step forward to getting a solution. And the same with providers. I would say, you know, we do want people to seek appropriate psychiatric care that may involve medication ultimately, right? But that first provider that they reach out to may not be a good fit. And so I tell folks who are saying, oh, I might need to get help for my child or for myself or a friend or a loved one. I'll say, it may not be the first person. You got to keep going until you find somebody who you feel a connection with, who you trust and you feel comfortable with, because I think it's very easy for people to get discouraged, or also with medication, right? They try the first medication and there are side effects, they don't get the benefits, whatever. You don't just throw up your hands, right? Or start self-medicating. You go back, you make adjustments, and that can be kind of a longish process. So I think it's good to prepare young adults for that.
I agree. I also think that we need to prepare them in the whole adage of see something, say something.
Yeah.
Okay. If you see a friend acting in a certain way, either talk to them, talk to other friends in the friend group and say, okay, has anybody else noticed this? And I think students now are more willing to speak up and speak to the friends that are having problems, or turn around and go to the RAs and things like that to kind of say, okay, this is what's happening. Can we kind of keep an eye on this so that it doesn't spiral?
And
Um,
universities have changed their policies, which I think is critical to understand. And I know they're letting folks know, because in the old days, if you said, by the way, I'm using drugs, you could actually be expelled.
right.
Like, so I know at University of Miami, for instance, I know they have made changes to the policy where they're encouraging people to come forward. Now, if you're caught with drugs on campus and you're selling drugs or whatever, or you've got it in your dorm room and it's like, okay, right, this is not good. They're not gonna, be happy with that. But they are saying essentially there are amnesty pathways, so that they can connect students with resources, again, to retain them and to protect their academic, their sports, all the things they're trying to achieve in college, by getting them connected with recovery resources, and mental health and physical health resources as needed. Because maybe they're trying to treat pain, right? If they're not getting adequate pain relief for an injury, we've heard anecdotal stories about people self-medicating with opioids and developing an addiction because of, something they were prescribed in college without a lot of guidance.
Yes. These are great messages. Two of the things that I really noticed you guys both talking about was reducing stigma when we talk about it. And this is for people who are experimenting, not the drug dealers, okay? For students on campus who have a problem or are concerned they have a problem or don't know they have a problem, talking about it, shining that light on the problem sometimes makes it less shameful and easier to talk about. When you say it out loud, it doesn't sound as crazy as it is in your head. We were talking earlier about how the Poison Helpline has no idea what's going on in your head until you communicate that. So again, don't be afraid to talk about it, because it's a stigma reducing activity, talking about it. And then another thing was the messenger. The second thing I want to talk about that I just heard both of you talking about was having the right messenger. Wendy, I believe that you said that RAs are a good resource. Absolutely, because they are close to the student's age. I'm the mom, And I don't know what my son thinks of me. He's heard me talk about drug abuse prevention since he was in elementary school. I'm the poison prevention volunteer at the elementary school, for heaven's sakes. He's heard me talk. I brought heroin addicts to church to talk about, how they got started and how, they're just regular people. They're not, their addiction disorder is not their identity. All these things, right? But I still don't think that my son would come to me if he had
Yeah.
a substance abuse issue and ask me for help. So having the right messenger to be there for him and guide him to those resources on campus or off campus would be very important. I appreciate you very much bringing up the fact that we parents need to realize that sometimes we are not the messenger that our child needs, but we need to help them see who those messengers might be. The RAs was a good suggestion. What were two other good suggestions? Angel, Wendy, one from each of you?
You know what? A lot of professors,
Okay.
on a college campus, when you go to college, you might make a connection with a professor, and that's fine. If you're experiencing a tough time, don't hide it from them. Don't just take the failing grade. Talk to them. Tell them what you're experiencing, because you know what, they may be able to point you in the direction of right answers or more resources. So I think that's important. College professors aren't, like regular, well, even high school teachers tend to be a good resource and a good sounding board for many students that don't want to talk to parents and things like that. So I certainly wouldn't hesitate to, if you feel a connection with the professor, reach out.
Thank you. Great suggestion. And Wendy, how about you?
Yeah, I would say peers in the sense of social organizations and on-campus clubs and type of things. I was really impressed when my daughter started at college that they had really, it was the first week that the clubs were just out there aggressively recruiting. And I really think, yes, it's to get kids involved in sports and whatever, but and to integrate the freshmen into but you know what it is? It's a lot about forming connections and getting people integrated into the campus. And then you have a group, not just your roommate who you may or may not get along with, but another sort of nucleus of people around you who then you can work with and you're not so isolated. So, and there's also peer education groups on campus that specifically focus on drug and alcohol prevention, or health education, or future nurses, future pharmacists, all these groups. I think they can also be very powerful because they're the ones at the booth at lunchtime, promoting different health related screenings and that type of thing. And I think that is another great way to connect on the health topic.
Great suggestions. So we've got RAs, professors, clubs, peer education groups. These are great suggestions. The messenger is important. And I appreciate that last bit that you were saying, Wendy, about connections. I think the opposite of having an addiction disorder that you're hiding is being connected and talking about it. So those are great messages. And it is possible. It's possible to have these difficult conversations with our young people. It's possible to get them connected. It's possible for them to hear the right messages from the right messengers.
In public health, we look for interventions that have multiple positive health outcomes. And one of the most powerful ones has been interventions that improve parental communication with kids and with young adults. So anything that strengthens that bond is very protective. And it turns out that better communication and more open communication with parents and between parents and young adults leads to things like reduced risk behavior for HIV, reduced substance use, like all of these things that you just wouldn't even realize necessarily they were connected. But it goes back to this issue of what you're seeing as feeling like you belong somewhere. And so I think as we send off our young people to college, I think more so than telling them don't do drugs, use medicine this way. And what we can say to them is, we're here for you and we love you no matter what. that's what only we can provide as parents. I think they have a lot of other resources, whether it's the school clinic and the campus and the friends and the clubs. No one else can provide what we can provide, which is that unconditional love and support no matter what. So, that sounds like a warm and fuzzy thing, but it turns out it's also a very powerful protective health intervention, ironically. So we've had to work on that in our families because it's easy to get distracted by the little stuff and trying to like, don't do this and do that. And, when are you going to do this? And just focus on we love you. We have faith that things are going to work out. We're here to help if we can.
Excellent messages. As we start to wrap this up, I want to give you each an opportunity to talk a little bit about whatever you would like to with the Poison Helpline, whether it's on the topic of drugs on college campuses or Poison Prevention Week coming up here in March. The floor is yours, Angel.
Well, I think, to kind of draw everything back to the resources of poison centers, you know, our range is huge. We can help with a very simple double dose and give you reassurance that you're going to be fine, or the expired pancake. But we can also help with so much more serious situations, and we don't want folks to be afraid to give us a call. Do the right thing. If you see something, say something, speak up and help and make the call. And your friends will thank you for it, ultimately. So, we want folks to understand that we are here for people of all ages. We are here for those folks that are embarking on, young adulthood and leaving home. We're here for the parents. If you talk to your kids and they mention something in passing, if you want to seem like you're in the know and just say, oh, okay, that's interesting, we can be a resource for that, to let you know, is this something you need to be truly worried about, or is it okay? So, parents can use this for information as well.
I like how you framed yourself as a resource. That's good. And for Poison Prevention Awareness Week 2024, when is it, Angel, and what's the theme?
Well, this year the dates are March 17th through the 23rd. So it starts on St. Patrick's Day. How about that? And the theme, and it's perfect for this podcast: when the unexpected happens, we are here for you 24/7. We could have made that the theme of the podcast too.
Still could. We
Yeah.
always record it before it goes out.
Uh-huh.
All right. Well, hey, thank you for sharing that. And I would like to toss it over to Wendy. Any closing comments?
Yeah, this has been a great opportunity to reach a different audience than we're often invited to talk about, right? They tend to come to us, everybody comes to us for the toddlers and little ones. And as a result, really, I think part of one of many factors, but as a result, we don't really have that many fatal poisonings in small children, and that's amazing. But we have a lot of work to do in our adult population. And that some of those problems really get started in young adulthood, whether it's addiction, et cetera, or just bad practices, not taking care of yourself physically, all these things, and mentally, of course. So I wanted to just point out that I think it's important for us to acknowledge that not all college students and young adults use drugs. And in fact, it's a minority. And I think we have to be careful not to, by trying to be preventive, to create this idea that everybody's doing it, because that can be confusing to kids because they're, especially when they look around, they see not everybody doing it, and they're trying to understand where they fit in. And I would like to mention that for kids that are involved in substance use early, it's often because of trauma and a lot of issues that they're trying to cope with. And in the United States now, we have about 25 million people in recovery or who consider themselves recovered from substance use. So I think we just have to acknowledge that it's something that's happening, and that we want to engage and support people and love people through it, and that people can and do get better. And I think that is a big shift, I think, for people from my generation, where we just said, don't do it, don't do it. But if you do, oh well. I think we want to change that approach.
This has been a great conversation. Wendy, thank you for those closing comments. Angel, thank you for yours. This has been a great discussion about young people ages 18 through 24 and how the Poison Helpline can be a resource for them and the people who care for them. Thanks again for being here today. Take care.
Thank you,
Thanks.
Kim.
Thanks again to Dr. Wendy Stefan and Angel Bivens, RPH, for being my guests today on the Pharmacist's Voice podcast, episode 268. I hope you enjoyed hearing how the Poison Helpline is a great resource for young adults ages 18 through 24. I hope you will also include it in your phone today, even if you're not age 18 to 24. That number again is 1-800-222-1222. Program the Poison Helpline phone number into your phone today, 1-800-222-1222. To find the show notes for today, go to thepharmacistvoice.com, click on the podcast tab, and then find episode 268. In the show notes, you'll find a link to the Poison Helpline number, which again is 1-800-222-1222. You'll find the Suicide and Crisis Lifeline phone number, which again is 988. You'll find a link to the book that inspired this episode, The Naked Roommate and 107 Other Issues You Might Run Into in College by Harlan Cohen, links for Angel and Wendy, links to our other poison prevention podcast episodes, my social media links, and more. Lots of links today. Everything you need is on thepharmacistvoice.com. Now, do me a favor, if you know someone who might like this episode, please share it with them. And if you like this podcast, please subscribe to or follow the Pharmacist's Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. Thanks for listening today. I'll talk to you next Friday.